welcome. Thank you for bringing it. I think what I'd love is to have some hearty questions, hopefully, or hearty conversations about how we're not urban technologists. Most of us aren't building technology that's kind of geolocating and doing air quality and personal reports and navigating this. And we're not teaching medical students, most of us in design, and most of us aren't partnering with architecture firms. But what is it that, how do we make, in your personal world, like backstage conversations, how do we bring in the built environment as a part of what we do everywhere? What were your tricks for making your careers different? Like, how do you get out of being a regular, whatever we are, to being someone who says, yeah, it matters how I prescribe, and you're only going to incent me based on my CAP scores and my patient sat, but what I really care about is the water quality or the school down the street. So that's where I'd start, and then I'd love audience questions with microphone. We have a microphone that'll be passed around since we've got some live streaming too. If anyone wants to chime in.
I would just say, so if the core of your question is how did we get started in this, I think what you heard as a common theme is that really, if you look at the data of what drives health outcomes, it's if you pay attention and let yourself be affected by that, it's pretty hard to ignore the fact that while, of course, continuing to improve healthcare delivery as best we can is important, that if there's 80% of health outcomes being driven by the stuff that's outside of healthcare, we got to do something about that.
Absolutely.
And if I don't know if we have any questions. Does anyone have a question that they want to bring with? Can you get the mic and then we'll start there? I have a follow-up if not after this one.
Okay, it's not necessarily related to what you guys were talking about right now, but my name is Daniel Weiss, and I'm a researcher in social inequalities in health. And I'm curious to get some thoughts from you guys about, you're talking a lot about the social determinants of health, which is a paradigm which has grown over the last few decades and has quite a lot of scientific support. And it's often focused on improving the living situation of lower socioeconomic groups, and transferring a lot of responsibility to policymakers and political actors. But at the same time, we have another paradigm that's growing and has a lot more focus the last few years, which is personalized medicine, which in many ways transfers a lot of responsibility to the individual and the patient, and in many ways focuses on technologies and services that are only available to higher socioeconomic groups. Mm-hmm. So I'm curious if you guys could share some thoughts on how those paradigms, that the dichotomy between those two paradigms and how they might work against each other.
You guys go. Yeah, I'd love to hear you.
Okay. Thank you for your question. What's your name? Daniel. Thanks, Daniel, for your question. I think you laid it out really well. From my perspective, I see that as a false binary. I think how you laid it out is how it's playing out, but I see there being this opportunity with platforms like Street Wyze and other platforms to begin integrating the two, right? So you integrate the social determinants of health, which then transforms into participatory health, which then moves into precision medicine, and it's sort of moving along this continuum, right? Providing this information, resources, and data to our communities most in need so that we can be more efficient about the quality of the healthcare that we give to the folks that need it the most. So that's my short answer, but I'd love to hear from the other panelists, their thoughts and insights.
Yeah, I have a thought on that. I think if you really think about what the exciting parts of personalized medicine are, they really represent, rethinking the dogma and the idea that as a physician, your goal is you wait in your office for someone to come in with symptoms of something, and that's when care begins. The real opportunity in personalized medicine is to get out in front to that first moment when you're at well state and you start to come off. To build on Antwi's point, the community level of that is data. Like, there's this flow of information where I don't want to wait to find out. I don't want to find out that a community already has these terrible symptoms, I'd really like to see the same thing. Like, how do we get out ahead of it? And then how do we redirect if we know these things like the social determinants of health are important, and we're not alone in this. Robert Wood Johnson, for example, is really focusing all of their grant making on culture of health now. And the idea of that is, let's directly influence the things that we know determine health, not wait for the outcomes.
Upstream rather than downstream.
Absolutely.
One thing I would just jump in and say is that the social determinants of health framework is very deficit-based, and something that Street Wyze does, Antwi has done in his own work, and I know the other panelists do as well, is really look at assets as well. And this gets us past that paradigm of the personalized technologies being only in the hands of people who have the privilege to have them. Actually, every community has assets. And even that community with the liquor stores instead of the grocery stores has amazing assets. And the Street Wyze platform actually helps lift those up so that communities of color, low-income communities, can actually better share those resources and organize around the assets that already exist in their communities.
You know, it makes me just think about how when I first started using technology in the hospital and advocating for it, there was all about all the people I was excluding. I'm going to get to your question about excluding using technology. And of course, the reality is that 77% of Americans defined by being over the age of 18 have a smartphone in their pocket now, and it crosses all SES, and it crosses all ethnic backgrounds, and it crosses all language. And when I think about what you're doing it's like we've learned over time, actually, from Susanna's really taught me, right? Community is our superpower. The aggregation of what other people think we care about. Your point about, like, I'm not going to walk down that street. I wasn't going to walk down a street when I lived in Philadelphia. It was a block from where I lived because I was too scared to walk down there. And I knew that because my girlfriends told me that. And now we do it on Facebook, and we do it other ways. And our sense of justice and our sense of even like Facebook living a police officer at your window, right? It's changing the game to say new technology allows the resources of the ecosystem to be discoverable, so that we can actually have anyone of any status get this access. But it is a requirement of all of us inside healthcare then to deliver and tell people about those solutions and make sure that they're still free, right? And I think that's where we're stuck with these partnerships. But I think what you all are doing and teaching me too is just that you're incorporating it and we're dumping it, and then we have to get the word out and make sure that the inside, outside people are communicating with. Thank you.
I wanted to touch on, Wendy, you started off talking about hope, and it was an extremely powerful message, and you all carried it through. And in your talks, what struck me was this is so obvious. But the reality is I'm going to be going back to my hospital on Monday and back into this big machine where we're going to deliver the same results we're always delivering. And I just want to ask for what is your advice? Your enthusiasm and will to change is amazing, all of you. And what advice do you have for all of us so that we can become those change agents in our own organizations?
I think, so I'm part of that machine and getting beat down by that machine every day, right? So I have to go back to that machine on Monday as well. And what I did was, it's so big, this problem, I just want to take a bite-sized chunk of it. And then really for me, I think the recipe for success was finding good partners, right? You know, finding partners like Antwi and his organization. There's so many of them in Philadelphia, but we don't talk to them as a health system. And so, you know, my colleagues think I'm crazy. I'm like always reaching out and working with all these nonprofits, and I don't need to do that. I could just make a good living treating complications of diseases for the rest of my life. I don't need to go upstream. So I think for me, it's really been kind of partnering with organizations like Antwi and Aekta have.
I'll just add that it's really actually a pretty exciting time in this space. The idea of health being addressable in the real estate and built environment is growing. I mean, that's part of why I think Street Wyze is well timed. It's riding on this interest in doing that and bringing in robust data stores. In my own world, what I'm going to keep doing on Monday, the reason I'm going to speak with commercial real estate investors is that I'm partnering, for example, with the U.S. Green Building Council with a grant from Robert Wood Johnson, and our goal is to make sure that a hospital administrator doesn't, like, if they want to say yes, that there's a way for them to say yes. So for example, right now, it's easy for a hospital administrator to say yes to making a world-class green hospital, but how to say yes to a world-class health-focused, community health-focused hospital in literally the way they deploy their real estate investment, it's not possible, but it's coming fast. And so, for example, my team is literally building out credits and parts that can be implemented and used within things like the LEED green buildings system, which is used in globally like close to 100,000 projects across the globe. You're actually now able to, with the tools we're making, direct health as an explicit goal of real estate projects. And I'll also add that I think what that's really setting up is an opportunity where green was a huge differentiator for companies. Now health is starting to become a differentiator too. And it's really because of the work of my co-panelists here. So it's an exciting future, actually.
We are out. We'll do one more question. Roberta, I'm so sorry. She's backstage getting mad at me.
As a web developer and a patient, we get a lot of asks for help. Like, oh, we need software developers, like engineers, come and help us. What do you want us to do? I've answered so many emails and started like conversations with people, and then they're like, oh, but so how can we actually be of help? Like, obviously, a lot of us have full-time jobs. Most of us have full-time jobs, but I try to spend my free time in the patient advocacy community. We need real asks. We need things that we want to answer solutions. We're problem solvers. Give us definitions.
Aekta?
Sure. Yeah. Thank you for being out there and being the bridge between these two worlds. And, I think you have a really unique insight into being a part of those two worlds. I would say you can talk to us. That's one place to start. And talk to other companies that are like us, or like the people who are out there trying to increase health for the most vulnerable populations. I think folks in your position have a lot of choices that you can make around where you do work or where you spend your free time. And then also being on the patient side, you have a lot of knowledge around what are the pain points, so you can ask a lot of questions and really understand what the underlying needs are and how we can help solve those.
So we're out of time. I'll just say, when we all go back Monday, I think we can remember, right, that failure after failure, we can maintain this sense of optimism. And I ultimately think, there's a Howard Zinn quote I was thinking about just now, which is ultimately, if you continue to act defiantly now, in the most tiny way every day, against what's not right, from what you believe is not right, it is in itself a victory. So every day, even on Monday, when you bring in what you think is important from your environment and what matters and represent someone who's vulnerable, you are upending what isn't right. Thank you guys so much.